This is 13A in your lab manual, page 125. Okay. Can you list the organs of the respiratory system? What are the organs that form the respiratory system? Lungs, okay. I'm going to put lungs at here. A pair of lungs, okay? You all know that. I didn't start there. So, when you say organs, that means it includes the passage, everything, right? Where does it start? The respiratory passage. Nose, okay? Nose and nostrils. It starts here. The passage starts here, okay? And then what's the next? Where does think about when you breathe in air, where would it go? So it gets through your nostrils, into your nose, and then moves to the back of the throat, right? You breathe it in, it goes to the back of your throat. That is called the pharynx. The pharynx is a common passage because when you chew food and you swallow, it also goes to your throat, the back of your throat. So pharynx is a common passageway. So if you look at the pharynx is separated into arbitrarily, okay? Just the portion that is behind the nose is called nasopharynx. Nasopharynx. The portion that is behind your mouth cavity is called oropharynx. Oro for oral cavity. Oropharynx. And then the part of the throat which is close here to your voice box, that is called the laryngopharynx. Laryngopharynx. Okay, so pharynx itself is just a passageway at the back of your throat, nose, mouth and throat, and that is just arbitrarily separated into naso, oro and laryngopharynx. After the pharynx, where does the air enter? What is here? The Adam's apple. What is this? Voice box, the larynx, okay? So air has to go through the larynx. Larynx is nothing but the voice box. From the larynx, where would the air enter? What is the passage? So let's draw this, okay? Nose, pharynx, larynx, and then you have this. What's this? Trachea, windpipe. So number 4 is trachea or windpipe. Picture. So this is supposedly my nose, okay? 2, this is pharynx. 3, larynx. 4, trachea. And then number 5, the trachea behind the sternum, it divides into 2. Okay? It divides into 2. Let's number this 5. Okay? 5 is known as, do you know? Right and left primary bronchi. Primary bronchi. These are the air passages, okay? 5. One goes to the right lung, one will go to the left lung. So primary bronchi. Now once this primary bronchi enters the lung, it is going to divide, so left and right. So on the left side, it is going to divide into 2. We'll number this 6. On the right side, it's going to divide into 3. Let's number these 6. Okay. So after 5, after the air has entered the primary bronchi, it then moves to number 6 is called secondary bronchi. Now there are other names for this also, but I'm just sticking to this one so that less confusion. Secondary bronchi. Secondary bronchi, there are 2 on the left lung, 2 on the left side, 3 on the right side. And you will see why, okay? When you look at the structure, you will see why. So number 6, secondary bronchi. And then, so this air passage is like the branches of a tree. The trachea is like the trunk, okay? And then the bigger branches are the primary bronchi and the secondary bronchi. And then it branches into smaller and smaller branches. So next branch, which will be multiple, okay? I'm just showing 3, but there'll be multiple branches. So let's number this 7 on both sides. There are no specific numbers or anything, but 7. Number 7 is called tertiary bronchi. Tertiary bronchi. That means the third level of branching. The first level of branching from the trachea is called primary bronchi. And then when it branches a second time, it's called secondary bronchi. And then the third level of branching is tertiary bronchi. So there are many tertiary bronchi. And then this, I'm showing 7 dividing into smaller and smaller branches like that. So as it goes deeper into the lungs, these will keep dividing. Okay, they become smaller and smaller. So I'm going to give this number 8. Imagine the same thing happening on the other side also. Number 8 is called bronchioles. Number 8 is called bronchioles. Bronchioles are air passages smaller than 1 millimeter diameter. So very, very tiny branches. Very, very tiny, 1 millimeter diameter. Small passages, very small passages. Okay, this will continue to divide. It will continue to divide. As it goes deeper into the lung tissue, it will continue to divide. So if you look how many times it divides, starting from the trachea all the way to the final branch, I'm going to number this 9. The branching happens 16 times. 16 times it branches. From the trachea, this is 1 primary, the second one is secondary, third one is tertiary. After that, 4, 5, 6, 7, 8, it will keep on branching 16 times. So it becomes smaller and smaller and smaller. And finally, the last one, number 9, very tiny. Number 9 is called terminal bronchiole. Terminal bronchiole. Okay? So let's keep this number 1 to number 9. We are going to see what that is called. Okay. And then, so here I'm going to draw the terminal bronchiole. We are going to start with number 9, which is a very tiny little branch like that. This is number 9. Okay. This will then divide into smaller branches. 10, number 10. Number 10 is called respiratory bronchiole. Respiratory bronchiole. Okay. Then this 10 will again further become small branches like that. Number 11. Alveolar duct. Alveolar duct. And then from this 11, these are very tiny, very thin branches. You will see a cluster of sacs like that. A bunch of grapes like that. Okay, so this is 11. So from here you will see okay. Now the space in the middle of this bunch, this common space that you see, let's number this 12. Okay, and each individual grape cluster, each individual sac that you see, 13. Okay. So number 12 is called alveolar sac. Alveolar sac. And number 13 is called alveolus. Alveolus is nothing but the air sac. This is the final thing. Alveolus is singular. Alveoli is plural. Many. Okay, alveoli is plural. So each one of them is called an alveolus. So if you take your lungs, so that your lungs is actually 10 to 13. Okay, of course all of this is also there inside your lungs. So your lungs is a very soft sponge-like structure. It's not a solid organ. It's a sponge-like organ, very soft, because it is filled with these air sacs. Okay, so that's what it is. So I have separated it out, number 1 to number 9, and then number 10 to number 13. Number 1 to number 9, that is from the nose and the nostrils all the way to the terminal bronchiole, the tiniest passage. This is called the conducting zone of the lung. Conducting zone of the respiratory system. It's called the conducting zone. Number 10 to number 13, okay, this is called respiratory zone. Respiratory zone. So what does conducting zone means? Conducting zone allows the passage of air in and out of the lungs. It is just a tube through which air can enter into these air sacs and air can leave. That's it. No other specific function. That's why it's called conducting zone. It allows the air to move in and move out. Respiratory zone, this is where gas exchange occurs. Gas exchange occurs between air in the alveoli and blood in the pulmonary capillaries. So the actual gas exchange occurs here. Actual gas exchange occurs here. So if I were to draw an alveolus like that, this is a single air sac. This is a single air sac. It is lined by simple squamous epithelium. This is the blood vessel, the pulmonary capillary. As blood flows, as blood comes into the lungs, the carbon dioxide that is in the blood will diffuse into the alveolus. The oxygen that is in the air that you breathe in will get into the blood. Okay, so this is what is gas exchange. Movement of oxygen from the air sac into the blood and movement of carbon dioxide out of the blood into the air sac, and then you breathe it out. Okay, so this actual gas exchange is only going to take place in this last part. All the remaining structures are only going to allow the air to come in and go out. That's it. No gas exchange occurs in any of these places. Okay, so this is the entire structure of your respiratory system. So we are going to look at it in pieces, in bits and pieces. So we will start with nose, pharynx. We will start with this one and 2. Okay, then we will look at larynx, number 3. Then we will look at 4, 5, 6. And then we will go to the lungs per se. Okay, so the first model that you have in your in front of you. So this is the picture here. Page 127. 127, figure 13.5. Mid-sagittal section of the head and neck. Okay, so you have that flat model in front of you. That's the mid-sagittal section of the head and the neck. Okay, this one. You to identify, because you have a picture and I'll also put it up on the monitor. You are going to identify, let's see, nares, nasal cavity, frontal sinus, oropharynx, epiglottis, uvula. Okay, I need you to identify a few more things there. Okay, open up to page 131. 131. It gives you a list of the structures. So we are going to start with nasal cavity. Okay, number 4. Under nasal cavity, I want you to identify A, B, C, and D. And also 1, 2, 3 under nasal concave. We'll talk about the importance of this. Once you have seen the structures, we'll talk about it. So A, B, C, D, 1, 2, 3. Under number 5, paranasal sinuses, identify A and C on the model, the same model, the mid-sagittal section. Identify A and C. You will not be able to see B and D. Identify number 6, 7, 8, A, B, C. And then under 9, please identify epiglottis, also on the same model. Okay, so this is what you have to identify. If you want to label, you can take it. Epiglottis, number 9A. Okay, nares, vestibule, nasal septum, nasal conchae, all three. Paranasal sinuses, sphenoid sinus and frontal sinus, hard palate, soft palate and uvula, pharynx, nasopharynx, oropharynx, laryngopharynx, and number 9, epiglottis under that, okay, for that particular model. Okay. So I will put up the picture for you as well, but do that, and then we are going to talk about the structures, the importance of the structures. Once you know where it is, we're going to talk about that and then move on from there. And then vestibule is that space just inside the nostrils. Vestibule is like a passageway. So that's the vestibule. So I'm sure you would have identified that. And then the conchae, these are those plates. When you did bones, you would have talked about this, superior concha, middle concha, inferior concha. So these are superior, middle, inferior. Now coming to the structure of the nose, function of the nose. Structure as well. What kind of cartilage is it? Eyelid. And then what is the bone right here? Oh, the skull is missing from that one. Nasal bone, yes, nasal bone. Okay, nasal bone. You've studied all this, so. Okay, right there, the nasal bones. Okay. All of you will know this one, the one here at the bottom. This one, the one here at the bottom. No. Huh? No, I think it is up here. This one I thought all of you. Vomer. Don't remember that vomer? Okay, anyway, now we can't go back to bones anymore. No time for that. Okay, what is the function of the nose? It's the first passageway. Warm the air, okay? Warm the air and also add moisture to it. So the lining of the nose is basically pseudostratified, ciliated, columnar epithelium with lots of goblet cells. So the mucus helps to moisten the air, and especially today is a wonderful day, but during winter when you go out exercising, the air outside is so cold. So when you breathe it in, by the time it reaches the lungs, the air has to be warmed to your body temperature, okay? Which is what the nose does. How does the nose warm the air?
Is it like a little hairs inside or something?
The hairs help to trap the dust, okay, and cleans it.
Yeah, concha, superior, middle, and inferior create turbulence.
Yeah, they create turbulence, but warming the air. How does warm? If the outside air is, cold? Exactly. The nose is richly supplied with blood vessels. Okay? It's a very vascular area. So by conduction and radiation, heat from the blood gets transferred to the air that goes into your nose. Okay? So that's why nose bleeding is so common, right? Some people have severe nosebleeds, especially when your nose becomes dry, and if you have a cold, you have nosebleeds. Why? Because the nose is a very vascular region, lots of blood vessels, mainly to warm the air. Okay? Now, sinuses. You have learnt about sinuses in Bio 141. Sinuses are found in the skull bones. Frontal sinus is one of them, which is in the frontal bone. And then you have the sphenoid sinus, which is in the sphenoidal bone. And then you have ethmoid sinus in the ethmoid bone, you can't see it. And then maxillary sinus in the maxilla. Okay? What is the sinus filled with? Air. Under healthy conditions, the sinuses are air-filled pockets in the bone. Okay? What is the purpose of these sinuses? What is the purpose of the sinuses? We talked about it.
Is it to like reduce weight of the skull?
Yes, decrease the weight of the skull bones. Okay, the air filled, because bone is dense, so having a few air pockets reduces the weight of the skull bones, so you don't feel like you're carrying a heavy weight on your head. The moment the sinuses get filled with mucus or infected fluid, what happens? What is your first sign of a
Horrible headache.
headache? Horrible headache, and when you bend down, that throbbing headache. Why? Because the sinuses are now filled with infected liquid, so that you're able to feel the weight of the skull. Okay? As long as it is filled with air, you don't feel that. Okay? And then the second thing, in respiratory system, why do we bring up sinuses? Because it helps with the voice quality. So when I speak, the air in my sinuses vibrates, and that gives that resonant quality to my voice. Think about a time when you had sinusitis, severe sinusitis, and think about how your voice sounded at that time. There will be no quality to it, no ring to it. Okay, because when you speak, the air in all your sinuses vibrates, and it gives that quality to sound. Okay, so that is frontal and sphenoidal sinus that you can see on this model. Now, the back of the throat, this is your pharynx. So immediately behind the nose is the nasopharynx. Behind the mouth is the oropharynx. And then close to your voice box, this is the laryngopharynx. What is this bone that separates the nasal cavity and the oral cavity? Hard palate. This is the palatine bone. Sorry, palatine bone. You call it the hard palate. So if you lift your tongue up and touch the roof of your mouth, you're going to feel this hard palate. From the hard palate, you have a soft structure that hangs down. This is called the soft palate. And the tip of the soft palate, the very end of the soft palate, is called the uvula. Okay? You can see this if you stand in front of the mirror and open your mouth wide. You will be able to see the soft palate like an arch, and in the middle you will see the uvula hanging. Okay? If you have never seen it, today go back and just say ah in front of the mirror. You'll be able to see the soft palate, which is like an arch, and then the uvula is the thing hanging in the middle. Okay? It has a very specific function. And then you have the tongue, okay, the oropharynx. What is this structure, this blue structure? Did you all identify that? This leaf-like structure? Epiglottis, epiglottis, okay. Now, so right here you see a passageway, epiglottis, and then a passageway. What is that thin passage at the back? Esophagus, okay? Don't forget that. That's the esophagus. So esophagus is directly on top of your vertebral column, okay, right here. On top of that is the trachea, okay? So esophagus is just next to, this is your vertebral column, so that's your esophagus there, okay? Now let's look at the function of all of this. Soft palate and epiglottis. So the air that you breathe goes through your nose, gets to your pharynx, and then it has to get into the larynx. This is the passage. The food that you swallow goes into your pharynx, and then it has to get into the esophagus and not the trachea. Okay? So you need to have reflexes that will prevent anything that you swallow to get from getting into your respiratory passages. So you need some protective reflexes. So whenever you're swallowing liquid or saliva or food, there are two things that have to happen. One, the soft palate has to lift up. So it's hanging down like that, soft palate and uvula. It has to lift up and close the opening into the nasopharynx and the nasal cavity. The epiglottis, which is like a leaf-like structure, has to fall down like that, like a flap. It has to fall down and close the opening into the larynx and the trachea, so that whatever you swallow glides into the esophagus and does not get regurgitated like that, or does not get into the larynx. And you all know what happens when, if you're doing too many things while eating, talking and laughing, you know what can happen. Occasionally, food or liquid gets into your larynx, and then what happens? You start coughing. So cough is a protective reflex to remove whatever has entered the larynx. Okay? The soft palate also, this is something we don't realize. At least this sometimes, if the epiglottis doesn't fall back, things can get into your respiratory passage. But this is something we don't realize. But every time you swallow, while you're speaking, you swallow saliva, this is happening. This goes up, this comes down. Okay? So this is a reflex that is coordinated by neurons in the medulla oblongata, the swallowing reflex. Okay? So if there is a problem in the soft palate, and sometimes children are born with, do you know cleft lip? Children are born with a cleft lip, or children are born with some problem with the soft palate. So the newborn baby, the mother will come with the complaints that when the baby suckles, when the baby is breastfeeding, milk regurgitates through the nose. It comes out through the nose. Okay? So that is because the soft palate is not doing its job properly. Okay? So that can happen. So when a child has cleft lip, then you repair the cleft lip and then things should get better. Now, another thing that I want you all to see in the model, in the nasopharynx, you see this tiny little depression, okay, on the model. That is the opening of the auditory tube. It's coming from the middle ear. Coming from the middle ear, opening of the auditory tube. Okay. I also want you to recognize the tonsils on this model. There are 3 sets of tonsils which are basically going to protect you from any pathogen that is entering through the air that you breathe or the food that you consume. Okay, so there are bodyguards. Tonsils are just bodyguards that are stationed around the nose and the mouth. There are three of them. Right behind the nose, do you see this? On your model, you'll be able to see it. Okay, this is called the pharyngeal tonsil, one of them. Pharyngeal tonsil, that expanded thing that you see. Pharyngeal tonsil is commonly called adenoids. In clinical setting, we call it adenoids. In some children who get repeated infections, this pharyngeal tonsil will enlarge. And when it enlarges, it blocks the passage of air through the nose, from the nose. So a child that has enlarged pharyngeal tonsil, the mother will say the child is always breathing through the mouth. So the mouth is always open and the child is breathing through the mouth because this passage gets blocked. So sometimes this tonsil has to be removed. Okay? But the one that generally gets infected in most people is this one, which is found in the just below the soft palate. On either side of the soft palate, you find this. This is the palatine tonsil. This is the one that gets inflamed in most of us in children as we are growing up, repeated infection. This one will swell up. And sometimes this has to be removed, tonsillectomy. Okay. Anybody here who has had a tonsillectomy? Okay, pretty good. So tonsils, you can spare, you can remove these if it is really causing a lot of trouble, then you have to remove this. Okay. But of course you have other immune system structures that can protect you. So this is a palatine tonsil, which is a pair, one on each side. Okay. Pharyngeal is single. And then comes one which is underneath the tongue. You cannot see it. So this leaf-like structure that you see here, underneath the tongue, this one, this is called the lingual tonsil. Lingua is tongue. So lingual tonsil. This you can't see. It's buried within the tongue. Okay, this is lingual tonsil. So that is about the structure of the sagittal section of the head and the neck. Most importantly, what is the function of the soft palate and the uvula? What is the function of the epiglottis? And then of course you should be able to identify the structures. Now we come to the larynx, the voice box. Okay, that is this one. That is this one. Okay. So in that model, which there is one on each table, you should be able to identify the cartilages that protect your voice box. So this is just the outer aspect. The actual voice box is inside this protected structure. Okay. So the largest of the cartilages, that is in front and on the side, which forms the Adam's apple, which is more prominent in males, less in females, again because of testosterone. This is the thyroid cartilage, because you know the thyroid gland is here. So it's called the thyroid cartilage. This is a butterfly shaped cartilage in front and on the sides, not at the back, only in the front and the sides, as you can see. So front and side. Okay. Now this is the bone which is not attached to any, this is the one that is not attached to any specific structure. It's at the base of the tongue, horseshoe shaped. All of you should know this bone. Hyoid. Okay, this is the hyoid bone. This is the hyoid. So underneath the hyoid you have the thyroid cartilage, which is here. Okay. Then below the thyroid is the next cartilage. These are all hyaline cartilage. Below the thyroid is the next cartilage, which is called the cricoid cartilage. The cricoid cartilage is narrow in front and broad at the back. So you see, this is the cricoid cartilage. It's broad at the back. So thyroid only protects the front and the side. Cricoid is below the thyroid. It's narrow anteriorly and it is broad posteriorly. On top of the cricoid at the back, this is the posterior view. Okay, this is the posterior view. You have a triangular shaped cartilage, a pair. This is called the arytenoid cartilage. Arytenoid. And on top of that, there is another smaller one which is called the corniculate cartilage. There's another tiny one also which is not visible here. So there are four that you should be able to identify: thyroid, cricoid, arytenoid, and corniculate. Okay. Now, inside this structure is the actual voice box. So this is just a protection around it. The voice box is made up of, let me show you here. It's made up of two pairs of elastic cartilage. Two pairs of elastic cartilage. One pair at the top, one pair at the bottom. Now think of your voice box like the strings of a musical instrument. If you play the guitar or the violin or whatever string instrument you play. Okay? If you play a string instrument, you know you have to tighten the strings to adjust the pitch. Okay? If the string is very loose, you won't get the correct sound, so you have to tighten it so that you get the right pitch. So your vocal cords are just like the strings of a guitar or a violin. So when you breathe in and out, they vibrate. So unlike a guitar where you have to pluck it, or a violin you have to use a bow, this one, movement of air will vibrate those elastic cartilages. So the one at the top is called the false vocal cord. The one at the bottom is called the true vocal cord. So this is the true one. Okay? So there is a pair, one on each side like that. When you breathe in, they move apart, air goes in. Okay? And then they come close together. So every time you breathe in and out, the vocal cords are going to move to allow air to get in to the trachea and then move out of the trachea. When you breathe out, they will move apart. And when you speak, they are going to vibrate. The vibration of the vocal cord produces sound, not speech. It produces sound. Ah, e, oo, e. It produces sound. When it comes out through your oral cavity, you use your lips, you use your tongue and the muscles of your face to shape it into words. Okay, but the sound is coming from here. The sound comes from here. So the speech is not produced here. Sound is produced, and then you are shaping it into the language or into words using the muscles of your face and tongue. Okay? So it's very fascinating. Vocal cords are extremely fascinating stuff. They are just two strings. Okay? They're just two strings. The tighter you stretch it, the higher the pitch. You can sing an opera. Okay? The more loose it is, the more lower is your sound. So exactly like a musical instrument. So if you are a singer, if you have trained vocally, then you are training these vocal cords. Okay? So you're able to sing different pitches because you can adjust the stretch on the string. What adjusts the stretch of the string? There are about 10 tiny skeletal muscles. 10 skeletal muscles attached to this larynx. They will be able to stretch and relax, contract and relax, to tighten the string or to tighten the vocal cords or to loosen the vocal cords. So high pitch means tight vocal cords. Bass pitch, more loose vocal cords. If I want to scream and shout, then I'm going to force air very quickly through the vocal cords so that my voice reaches far. When I want to whisper, very little air is going through my vocal cords. Okay? So that's an entire vocal cord physiology on its own. Okay? Very important. Now, why do men have a more deeper voice than females have a high-pitched voice? That's because of the vocal cords itself. So in men, the vocal cords are thicker. These elastic ligaments are thicker. In women, they are thinner. Again, because of the effect of testosterone. Testosterone thickens the vocal cords. So that's why when the male child is going through puberty, the voice cracks. The voice changes from a high-pitched voice to a more low-pitched voice because the vocal cords are becoming thicker at that time. Okay, so that is about the larynx. So I want you to look at the structures of the larynx, and also we'll go to this one. This is an easy one. This is an easy one. So you can actually identify everything. This is the trachea, okay, the tracheal cartilages, which are also hyaline, and then the primary bronchi, secondary bronchi, and then the colored ones are the tertiary bronchi. Now in the trachea, I want to ask you, the cartilage, how is it? Does it go all the way around the trachea? Take a look at that and tell me. No, right? It is C-shaped. The cartilage is C-shaped. Okay? So the trachea is roughly about 10-12 centimeters or a little more than that. The cartilage is intermittent. It's not continuous. It's hyaline cartilage and it is C-shaped. You only see it in front and on the sides, nothing at the back. The back is actually made up of a muscle, smooth muscle called trachealis. Trachealis muscle, the back. Why do you think the trachea does not have circular cartilage and only has C-shaped cartilage? What is the functional necessity?
The muscle contraction.
To make it easier to
make it like change shape.
Let's start with this then. What is the purpose of cartilage in a tube? What is the purpose of having cartilage in a tubular structure? Maintain? Maintain patency, or to prevent the tube from collapsing. If it is only muscle, then it will completely close, right? So the cartilage allows the structure to remain open. Now let's come to this. Why is the cartilage only C-shaped and not round, O?
to make it smaller when a contraction happens behind, so it can
Okay, so you're getting there, but what is behind?
muscle. No?
No, this is muscle.
Okay.
You said,
Oh, when you have food. No?
what is there at the back of the trachea? What is the esophagus? What is esophagus made up of? Smooth muscle. So when you're not swallowing anything, the esophagus is flat because it's smooth muscle, okay? When you swallow something, the smooth muscle opens up, okay? Now think of the esophagus. At the back is your vertebral column, okay? So can it expand backwards? No, because there's bone. In front, there is trachea. If there was cartilage here, would the esophagus be able to expand smoothly when you swallow? No. So the reason why the trachea has C-shaped cartilage is to allow the esophagus to expand or open up during swallowing. Okay? Otherwise, you won't be able to. So yes, you need C-shaped cartilage for allowing the esophagus to open up when you swallow. Okay? Now another thing that I want to, this is how it is, okay? This is how the trachea is. This is right. This is left. This is going to the right primary bronchus, left primary bronchus. And then when it divides further, that is the secondary bronchus. And then these colored ones are the tertiary bronchi. Now, if you have a toddler at home, usually the thing is they pick up things and put it in their mouth. Very often, children might pick up something very tiny like a seed or a bead or a penny, and they may put it into their mouth and accidentally, it might, instead of entering the esophagus, it might enter the trachea. It might go through the larynx and enter the trachea. If it's very tiny, like a little bead or a seed, it might enter the trachea. Now, the child is going to have some cough, and then if they take them to the ER, the emergency room, the person on duty or the anesthetist is called, and when you have to remove that foreign body, when you have to remove what has gone in, they put a scope inside. It's called a bronchoscope. You can put a scope inside and you can pull that thing out. Most often, the first place that they will look for, of course, they're going to put the scope inside, they're going to look at the trachea. If they don't see anything in the trachea, the first place that they go to is the right primary bronchus. They go to the right side first. They don't look on the left side. Because majority of the time, the foreign body would have entered the right bronchus. Why do you think that is the case?
Slope.
Yes. Which one looks more straight? The right bronchus, right? See, the right bronchus is almost a straight continuation of the trachea, whereas the left angles. Okay? And another thing, the right primary bronchus is slightly wider than the left primary bronchus. So, whenever something goes into the trachea, the first place that it might go is the right primary bronchus rather than the left. Okay? So, these are some the clinical importance of the structure itself. Okay? So, that is about the trachea, bronchi, and the larynx, okay, the voice box. So, what is this structure? Epiglottis. This is epiglottis. Okay. So, in this one you can actually pull the string and it shows you how the vocal cords will go back and open and close, open and close. Okay, this is one vocal cord, this is the other side. The one that is important for making the sound is the true vocal cord. The false vocal cord is just a protection. Where am I going? So, the false one is just for protection. It's the true one that actually makes the sound. True vocal cord. Okay? So, can you look at the vocal cord? So, you have looked at the air passages, you have looked at the larynx, now we go to the lung proper. Before we do that, so the air passages, trachea, the primary bronchi, have C-shaped cartilage, you will see it, and then pseudostratified ciliated columnar epithelium that lines the inside. As it branches into secondary and tertiary bronchi, the cartilage will slowly keep on getting reduced. Okay? And there will be more smooth muscle that forms the tube, and the epithelium will also change. It's no longer going to be pseudostratified ciliated columnar. It may be in some places it becomes stratified cuboidal. Once you go to the bronchioles, these are passages which are less than 1 millimeter in diameter. They do not have any cartilage, no cartilage at all, only made up of smooth muscle. The tube is only made up of smooth muscle, and the lining now becomes simple, like a single layer. So, in the air passages also you are going to see this distinction, okay? And then once you reach the respiratory zone, the respiratory bronchiole and the alveoli, here you're only going to see simple squamous epithelium. Simple squamous epithelium. Why? Because this is where gas exchange occurs. So in order for gas exchange to occur quickly, you cannot have a thick membrane. You can't have a thick epithelium. You need to have simple squamous epithelium. So no smooth muscle, nothing. Just a lining of simple squamous epithelium to facilitate gas exchange. Okay, so in the passages also you're going to gradually see a change in the histology. A change in the histology of the thing. Now, the last part of this, of course we have to look at physiology, maybe that's at a later date, but the lung itself. So you have a model of the lung. Now comes your, I'm going to come around and ask you, because this is cardiovascular as well as a little bit of respiratory system. So these are the things. Try to identify these things. Right lung, upper lobe, middle, lower. Left lung, upper, lower lobe. Okay, these are the lobes of the upper, middle and lower lobes of the right lung, upper and lower lobes of the left lung. Then number 3, identify horizontal fissure, horizontal fissure, oblique fissure, oblique fissure. The lung, you can remove the top part of the lung, and inside in the lung identify trachea, esophagus, primary bronchi, right and left, okay. Primary bronchi, you can also identify secondary bronchi on the lung model, okay. You can identify secondary bronchi as well. And then most important, now let's come to this. 8. Branches of pulmonary artery. Number 9. Branches of pulmonary vein. Okay. So label all this. I'm going to come around and check each group. Okay.